national coalition of over 300 organizations and ultimately end the hepatitis B and C epidemics in the United States. I encourage you to visit our website, www.nvhr.org, and consider joining your organization, if not already a member, or by signing up for our listserv as an individual. You can go to www.nvhr.org for more information. Before we begin today, I'd like to go over some housekeeping items. This webinar is being recorded, and slides from the presentations and the webinar recording will be made available to everyone who registered and will also be made available on NVHR's website, www.nvhr.org. All lines are muted to eliminate background noise. You may submit questions at any time during the webinar using the chat function or by emailing Tina Broder, who is our Senior Policy Manager. Her email address is tbroder@nvhr.org. That's tbroder@nvhr.org. I also want to organizing today's webinar. We will have a question and answer period following all of the. We will also make contact information for all presenters available in case you'd like to communicate with them directly. Today we will hear from 3 hepatitis C advocates who will share their stories and the innovative work they are doing in their community. Each panelist will speak about their personal life experience as patients and how it led them to the work that they currently do. They will share information about challenges their clients face in their community they have learned. We hope that webinar participants will feel inspired and hopeful after learning about what these 3 individuals have achieved, and will leave this webinar with ideas on how they can become more engaged as patients. I will provide a bio for each speaker before their presentation, and we will start today with Christopher Abert. Chris survived interferon, ribavirin, and Sovaldi treatment to achieve SVR in 2014. Congratulations, Chris. Chris helped found the Indiana Recovery Alliance Harm Reduction Project in Southern Indiana, and so now I would like to turn it over to Chris. Chris, and I'm seeing Chris on.
Am I not on mute anymore?
You are not on mute anymore.
Hello.
Okay,
welcome. Thanks, Ryan. And thanks, Tina, for putting this together, and the other panelists for coming, and to everybody listening. We're excited to be partnered with NVHR in really important work in hoping to eradicate hepatitis. So we, when I say we, I mean the Indiana Recovery Alliance. And again, as was mentioned, my name is Chris Abert. My experience with hepatitis C goes back to the late 80s. I was an IV drug user, and I'm pretty sure that one of the very first times I did IV drugs, I contracted hepatitis C. And of course, we know now that 90% of IV drug users have hepatitis C within the first year of their use. I just happened to have used people who were infected, and we used water to rinse the syringes. Today, I'm a person in long-term recovery, and what I mean by that is that I haven't used drugs or alcohol in over a decade. And that was, a lot of that was through being met where I was by non-judgmental people and recover in a non-coercive environment. And it's one of the reasons that harm reduction really speaks to me today, because I think that while that's not sufficient for recovery, oftentimes for people who suffer from substance abuse disorders, I do believe that it's necessary. So I applied for, let's see, I have a pretty vast criminal record, and I was laid off from my job. In being laid off because of my criminal record, I have looked up a previous record from a juvenile, actually 30 years. Can you still hear me?
We can hear you.
Yes. Okay. Okay. Sorry, my screen says we're having difficulty. So I had been laid off, and I signed up for the Indiana's Medicaid program, which is the Healthy Indiana Plan. In signing up for that, this was prior to them having a lot of restrictions on hepatitis C treatment, and I squeaked in before the laws changed, before the guidelines changed in Indiana. So I was offered Sovaldi, ribavirin, and interferon, and after 3 months, I reached sustained viral response and was declared hepatitis free. So that was a huge point in my life. Also, one of the worst summers ever, even including abuse and incarcerations. So it was very, very difficult. Sorry. Out of all that, I am a social worker, and I had met with some people who were also social workers, and we were trying to do a street outreach project, and we really wanted to go out and help people who were feeling a lot of pressure from police and from neighborhood groups, basically unwanted, the unwanted community. And in doing that, we were asking people how we could be helpful and what they needed, and one of the things that kept coming up was access to clean syringes and other supplies for IV drug use. There was definitely a gap in service in Bloomington. So a few people, for background on Indiana, it is a felony to possess a syringe in Indiana. So they're very hard to come by, and these won't sell them. So we decided we wanted to look into doing that, so we added that to our outreach project at great legal risk to ourselves, and started doing that just because we saw the need. We also started communicating with IU Health, which is the local hospital system. We started communicating with Positive Link, which is hepatitis C and HIV care and coordination in our part of the state, and different other social workers and social service organizations to find out what exactly we could do to get a needle exchange, above ground needle exchange going. And what we found was that we weren't going to be able to do that, and then lo and behold, Scott County, Indiana happened. And for those of you who might not know, Scott County is the largest HIV outbreak in the history of our country, definitely the largest of IV drug users, with over 188 confirmed HIV cases in a town of about 4,000. So per capita rate, that is more prevalence than sub-Saharan Africa. My understanding is that the CDC told our very conservative governor that if he did not do something to contain the outbreak, that they would come in and contain it. And so with much armor, he agreed to have a reactive syringe access program in Scott County specifically. And then the legislators in the state moved forward with great prodding from different groups to allow for, again, a reactive syringe access programs. If a county has declared an epidemic as either hepatitis C or B, then they can apply to the State Board of Health for permission to do a syringe access program. And typically this is done through the county health departments. Since there were already people in Monroe County who had rapport with that population, we went to the county and asked if we could provide that service. So myself and one other person from the original project moved over and began the Indiana Recovery Alliance, and there is our slide. That was very good timing. And if you can show the next slide. Hello?
You can still hear you, Chris.
Can you show the next slide?
You want me to keep going? I'm on the second slide with 2 photos right now.
Oh, I'm sorry, I don't see it on mine. Okay, well, if there's a slide there with 2 photos, you'll see a very small garage. And in that small garage, there's almost no supplies. We had a bike and a couple of trailers. We had a box of 100 syringes, and that's the original project. And then it should be truck with people out front, and then a room full of people. Do you see that slide?
Yes.
Okay, so that slide, if you look there, actually Alicia Suarez is in that picture, and she's part of the NVHR, if you're familiar with her. She's in the purple shirt. But by this point, we had pretty good community support, and we were in that picture putting together naloxone kits. The opiate overdose epidemic in Indiana also pushed legislators to allow for naloxone to be distributed, and the Indiana Recovery Alliance took up that challenge. And then the very next slide should be the van with a coffee pot sitting out front. We worked closely with the Chicago Recovery Alliance, who are also doing hepatitis C and HIV work through harm reduction, and they actually donated this van to us for $1. So we started going out and going into the community and giving out safe use supplies, as well as, if you go to the next slide, starting to do HIV and hepatitis C rapid testing. So we started doing that. Oh, now I can see what's going on with the slides. That's great. Here we are. We started doing OraQuick rapid tests, and most recently we've gone back up to Chicago, and we were all trained in phlebotomy, and we're going to start doing blood draws so we can do RNA quantitative. So no longer testing for HCV antibodies, but we can actually be testing for viral loads, which is pretty exciting. I know that up in Chicago they've been saying many people who thought that they had a viral load are finding out that they actually don't have a viral load, that they've had an SVR without treatment. So we're excited very excited to be able to do on-site blood draws and get confirmations for people. And that's pretty much what's going on here in Indiana. There is currently an ACLU-sponsored class action lawsuit against Healthy Indiana Plan for the restrictions that they've put on hepatitis C treatment, obviously due to the financial burden that they think that it would impose on them. So when people come in, we have quite a few things that we would like to work. First and foremost, we'd like to collaborate with them to make better, to mitigate some of the health risks involved in that lifestyle. Secondly, we'd like to help to remove the stigma from both the hepatitis C and from IV drug use or in general. And third, we'd like to really advocate. We recently went to Washington, D.C. and testified between a joint session with some other people, actually, from NVHR to try to get the ban lifted on needle access. And we're active locally in trying to get not only people signed up for that lawsuit, but people to get treatment in whatever capacity we can do that in. So we're excited about possible projects in the future of helping to fund and help people who have been denied access to hepatitis C treatment, particularly people who are not in late stage, right? People who are denied because they're not sick enough, and also people who are continuing to use drugs, and to get those restrictions lifted and or other treatment options available for them. Mostly, I think we're just excited also as social workers because this is a total grassroots project where we are really excited to be in these non-coercive roles where we meet people where they're at, where it's all voluntary. There's absolutely no strings attached to us helping and collaborating. And in doing that, we've been able to, we think, already affect pretty substantial change in our community. And just our existence, again, helps to start relieve some of the stigma. And, you know, that stigma that literally kills people. So I think that is all I have. And again, I want to thank Tina and Ryan and everybody listening, and I look forward to listening and hearing from the other presenters.
Excellent. Thanks so much, Chris, for the great presentation, and it was great to see the picture with Alicia Suarez, who is on NVHR steering committee, so thank you for highlighting that. So now I would like to introduce our next speaker, Kimberly Morgan Bosley. Kim is the president of the Bonnie Morgan Foundation for HCV and a strong advocate for hepatitis C, putting a personal face to this disease by sharing her story at many conferences and public venues. Kim was cured under a trial in 2014 for late-stage liver disease and now dedicates her time in raising awareness and urging others to get tested, get treated, and get cured. Welcome, Kim.
Thank you very much. And I also want to thank Tina and Ryan for inviting me to share my story and share about the Bonnie Morgan Foundation. I'm Kim Bosley, president of the Bonnie Morgan Foundation. Next slide. It was back during my historical birth in 1968, being the first baby born to a kidney transplant patient, that both myself and my mother received a blood transfusion that we learned many years later in 2005 that was tainted with hepatitis C. Because my mom, being a transplant recipient, she was not eligible for the then only treatment of interferon to cure her hep C, as it would shut down her transplanted kidney or damage it beyond repair. Sadly, she passed away in 2006 from end-stage liver disease. Next slide. It was the end of 2011 that I learned I had stage 4 cirrhosis. I went on to be treated in early 2012 with interferon and ribavirin, but after only 12 weeks, my doctor pulled me off for not responding. It was a very difficult time, obviously, for me, as I had 2 very young children, a business, and witnessed firsthand how hepatitis C can deteriorate one's body, causing death. It was in late 2013 that I was excited to be a part of a trial for late-stage liver disease. I learned that only after 1 week I was undetected, going from a viral load of 17 million down to detected in 7 days. I was astounded. However, being on the trial, I had to finish the remaining 47 weeks required to do the trial. Spending almost 2 years in the trial, my liver team became my family. They saw the struggles I faced daily and also shared in the victory in the end. Next slide. Since being cured of hep C, I've shared my story with many media outlets, including Second Opinion, PBS NewsHour, and a documentary with Health Central. Next slide. I feel it was very important to put a face to this highly stigmatized disease. When I was first diagnosed, it was what I call a closet disease, meaning many people look down on one having hep C. It was a very lonely, scary time, and my future and the future of those with hep C was very unknown. Next slide. Advocacy has become a major priority in my continued fight for hep C. Next slide. I feel government leaders need to know the importance of getting funding to hepatitis C and all its communities, as it's now the worldwide epidemic. Meeting with them personally, sharing my story, I feel it helps them understand and put a face to this disease. Meeting someone in person tends to do better than a letter. All of the work done on Capitol Hill we must all continue to do so that we can raise the importance of what and how hepatitis C is Next slide. The Bonnie Morgan Foundation was launched in 2013. The main mission of our foundation is to raise funds to help those with the high cost of co-pays and the treatment for hepatitis C. It is also our mission to bring awareness and education to the public about Hep C, the importance of getting tested early. Knowing the end result of hepatitis C, I know the debilitating aspects of how it deteriorates the body. I've also included it into the foundation's basis that we help those by supplying medical equipment and devices to those who cannot afford. Many in the later stages of hepatitis C become disabled and unemployed, therefore not affording the co-pays and the medical devices needed, such as walkers, canes, wheelchairs, lifelink buttons. And this is where the foundation comes in, and we help those with that service. Next slide. It has become our foundation's signature idea to put faces to this disease. Each year we collect, with permission, photos from for our shirts and banners for this particular year's walks, public functions, anything that we're out in the public. This allows people to see this disease does not discriminate and that it affects every age, gender, race. We are very active in the communities across the U.S., participating in various cities' liver walks, testing sites, and parades, passing out educational material, and sharing the extreme importance of getting tested. Next slide. As a foundation, we also sponsor over 15 Facebook closed private support groups that range from general info on hepatitis C to each treatment group, such as Harboni or Sovaldi, depending on what treatment they are on. They can join a private group with others that are in that treatment. We screen them so that nobody can get in unless they are on that treatment. We also have a group for diet. As we know, diet for the liver is extremely important. We want to have healthy livers, so we provide a group that provides recipes and ideas for healthy living for the liver. Also, foods that they should be avoiding, such as salt, etc., and high proteins. We recently created a dual fighters group, and I've noticed that this one is slowly taking off. It's still a very high, you've got two highly stigmatized diseases trying to come out, so to speak. I'm finding it very helpful to have a dual fighters group, those suffering from hepatitis C and HIV. It's giving them a place to connect with other dual fighters. Next slide. These online groups, I know from personal experience, are helpful and are bringing those too sick to travel or sit through an in-person support group. It allows them to bond with others without leaving the comforts of home. I personally create and promote positivity. I create positive photos for each of these groups. This disease is extremely negative on its own. Next slide. I find that posting uplifting and encouraging posts help keep these people focused on the fight ahead. I've gotten so creative over the years to add ones pertaining to TV shows, trying to find something to connect with people. Created one, as in the previous slide showed, Shark Week. Next slide, or nope, stay there, sorry. Let's see. Yeah, now we're ready for next slide, I'm sorry. Recently, this last couple weekends was the Super Bowl, and I got my creative juices flowing to do a hepatitis C football campaign. Each play that was called sides, fumble, touchdown, I created a post, and I flooded social media with these posts. I feel it's a way to connect with those that are unconnectable. Next slide. The Bonnie Morgan Foundation will continue to find ways to reach the unreachable and let those people know that this disease can be cured. Next slide. The journey may not always be easy, but through the encouragement, keeping them focused and positive, they too can reach the finish line as I have. Next slide. The last words spoken from my mom was not without a fight. I will continue to do this until the last person crosses that finish line. Together we are strong. Thank you for your time, and thank you for those who have attended this.
Great. Thank you so much, Kim, for sharing your story and for all of the work you do and for sharing your creative strategies to share awareness. We really appreciate it.
Thank you.
I would like to now introduce our final speaker for the day, Joshua Lee Byrne. I hope I got the name correct. Joshua is a community health worker and the facilitator of a monthly hepatitis C peer support group taking place in Nevada Hopes, the only group of its kind in northern Nevada. Trained as a hepatitis C community educator by Alan Franciscus of TV Advocate, Joshua has been living with hepatitis C since 2000 and is excited to meet soon. So welcome, Joshua. Thank you.
Thank you. Thank you, everybody. Can everybody hear me?
Yes.
First of all, I want to say thanks again for having me and allowing me to talk about my work that I'm doing here with Hopes and with some other people. And I also want to apologize ahead of time for my, I feel like I'm surrounded by a lot of PowerPoint and slideshow masters. I'm just a beginner, so I hope you'll bear with me, and I hope my slides carry weight, but the important thing is also in the message. And so let's start with the next slide. We'll talk a little bit about my personal story. I believe I was actually diagnosed with hepatitis C the first time in 2004. Ironically, it was somebody who I knew, an employee of the local Syringe Exchange, who had been encouraging me for some time to get tested, and I had always found a reason to not do it. And in 2004, I found myself living at what would be the first of several residential treatment facilities. I am a former injection drug user who had about 9 years of IV heroin use under my belt at the time that I received my diagnosis. And because I was in residential treatment and trying to get my life in order, I finally succumbed to his wishes and took the test. I was actually really surprised to receive the positive diagnosis because I was exposed to the concepts of harm reduction exchange early on. The university I went to had a service learning requirement, which meant that I had to volunteer at a local nonprofit. One of my best friend's girlfriends happened to manage the local Syringe Exchange. And so I don't know if it was, I mean, I was interested, but I honestly also thought, hey, easy A. And I wasn't, I didn't know what life had in store for me yet, but I thought harm reduction. I knew about, I mean, I knew it was really terrible, the idea to share needles, but I was still pretty ignorant about the dangers of hepatitis C transmission, and I thought as long as I never shared a needle, I would be fine. But little did I know about the dangers of cottons and works and all the associated items and the risks that they carry. So moving forward, as you mentioned, I was certified after a training with Alan Franciscus, Dr. Franciscus of the HC Advocate organization in 2013, and as a contingency of my certification, he made me promise that I would start a peer support group here in Reno, and he sounded pretty serious at the time, like he might actually come back to check and make sure that I was actually doing it. So I figured I better get serious about it, and so that's how that got started. We're going to touch on that in a little bit. Aside from my work with Northern Nevada Hopes, the latest personal development for me from a Hep C struggle or policy standpoint has been an opportunity to continue and influence common sense public health and drug policy following a recent appointment last year to Nevada's multidisciplinary prevention advisory committee, which is I was appointed by Governor Sandoval, and I'm one of 13 voting members appointed, able to work at the state level, so meeting regularly in Carson City to work on issues like accidental overdose prevention and statewide messaging on issues like HIV and hepatitis C prevention, education. The opportunity came about as a result of me presenting testimony to the state assembly when we were working on syringe decriminalization, and a few years later when we were working on naloxone legislation, Good Samaritan protection legislation, and all that. Evidently someone took notice while I was talking, which is nice to know that your voice is heard. Sometimes you don't know if it is or not. And because of that, someone at the governor's office asked me to accept the position, and I am the lone stakeholder or consumer representing drug users, or the IDU population in a room full of law enforcement and professional legislatures and bureaucrats, which can be kind of intimidating at times. It's quite an interesting turn of events, and if you would have told me, as little as 6 years ago that I'd be doing something like this, I would have told you you're out of your mind. Looking at the slide, a big part of my personal story that I skipped over is just the coalition building aspect that we've done here in Reno, and actually gave a presentation at the last Harm Reduction Coalition conference in Baltimore on the importance of coalition building and how we did things through that model here in Reno, using Northern Nevada Outreach Team, the Public Health Alliance for Access, which is now the Public Health Alliance for Safety Access, and the small group of people were able to get syringe access decriminalized, and finally have naloxone distribution, low barrier naloxone distribution available in this state. And my job here at Change Points did not exist prior to that, and because of what I had learned through the way that I was infected by, I believe, a cotton, we have our mantra here at Change Point, which is one hit, one kit, and don't share shit. And that's a great way to not get Hep C. Every time you make a hit, use the kit in its entirety. Don't share anything, throw it all away, and start over next time. Next slide, please. So as I mentioned, for the last 2 years, I have been facilitating Northern Nevada's only monthly HCV peer support group. That's that's modeled on Dr. Silvestri's Oasis clinic out of East Bay. I, at the time, was the only group model I could find out there that was based on a sort of come as you are harm reduction model, that was not focused on abstinence as a route to recovery, but as a possibility, but not the only possibility. So I also am at at Change Point, which is a program of Northern Nevada Hopes, I am also an HIV Hep C tester and counselor, a sexual educator, and I help to run the only syringe service program in the entire state of Nevada, and that's Change Point Harm Reduction Center. Change Point is truly a labor of love for me, as prior to, or when I moved to the state, it was actually a felony to possess even a clean needle. But thanks to the work of the coalitions that I mentioned earlier, a very small group of people actually started with like 4 of us meeting at Otto Wild Park every month or so to talk about, well, this is a bad law, how can we get it changed? And you know, when I moved here, I thought I might start some sort of underground backpack, you know, exchange. But then some colleagues at the Harm Reduction Coalition introduced me to some people that were sort of on the same page already, and one thing led to another, and now here we are in July 2013. The man on the left there, which I believe might be placed on the endangered species list soon, because what you see there on the left is a moderate Republican. His name is Brian Sandoval, and he's our governor. And he signed into law SB 410 in July 2013, legalizing syringe access. And following the establishment of some operations for the state, Northern Nevada Hopes opened Change Point in January of 2014, which is an integral part of what was their pre-existing harm reduction and outreach department. And as a longtime volunteer with firsthand experience that would normally disqualify me from other jobs related to injection drug use, overdose prevention, prison, and street life, and as the only volunteer with previous experience as a consumer and volunteer at another syringe service program, I applied for and was offered a position as a bilingual outreach worker in 2014. So one of the amazing things to me about Northern Nevada Hopes as it functions within, or at Change Point as it functions within Northern Nevada Hopes, is the example of the possibilities of effective integrated care. So you say a Change Point participant has been using us to access services, syringes, and whatnot for some time. Well, every single time they sit down with one of our volunteers or myself, they're asked if they have been tested for HIV or Hep C any time in the last 6 months. And they're also made aware that we offer free confidential rapid testing here in this same building every day that we are open. And there's no we try to make it as low barrier as possible. There's no appointments necessary. You just drop in to the drop-in center. So let's go further and say that this client decides to take advantage of the free testing, and their preliminary test comes back reactive, indicating exposure to the Hep C virus. Rather than sending them out the door with a referral for a confirmatory test and good luck wishes, we were able to walk them over to the on-site lab in our new community wellness center and do the blood draw that same day. When they return in a week, we confirm that they are indeed positive for hepatitis C. Again, this is a rhetorical situation. But instead of wishing them well and referring them to another facility to plan their care, we were able to fast-track them to becoming a patient of Northern Nevada Hopes, one of the best HCV clinics here in Reno. Of course, they are free to choose another provider if this suits them better, but as a patient of Hopes, they would also be able to access our amazing behavioral health team should they have any emotional support or counseling needs related to their treatment or anything else, as well as primary care labs and an on-site pharmacy. If they have low-functioning cognitive abilities or struggle with attention deficit disorder, or maybe like me, they're just really, really unorganized, they could benefit from case management services, which are available from our social services department. A case manager can help eligible clients to qualify for disability, help them to remember appointments, and arrange for them transportation to these appointments, and even make clients aware of special programs like housing and stuff that they might not be aware that they even qualify for. So a lot of opportunities, as you can see, and it's all designed to be as low barrier as possible. It doesn't always succeed the way it looks on paper, but when it does, it's a really great feeling. And to me, it's the definition of integrated healthcare. On one campus, a person can come in to access safety supplies like condoms and syringes. They can be tested for hepatitis C and eventually treated, and they can attend a monthly peer support group for hepatitis C patients and their loved ones, and they can utilize auxiliary support services such as individual counseling and case management. So one of the challenges unique to this agency, however, is that as we have been growing and expanding so rapidly, we want to retain our focus on all marginalized communities, which is one of the bases of Northern Nevada Hope's mission statement. But as we started initially as only an HIV clinic and nonprofit, doing that without ostracizing our original core community, which has been, which was almost entirely queer and HIV positive, has been something of a challenge. And that's one of the unique challenges to this agency. But I also recognize how fortunate I am to have a Syringe Exchange that's attached to a federally qualified health care center, despite all the bureaucratic intricacies that have been a real education for me. Just knowing that our light bill is going to be paid and that we can afford to order syringes. I know what it's like for a lot of my colleagues, and I certainly have been a consumer and a volunteer at Syringe Exchanges, where they didn't even know how they were going to pay their next light bill or order their next pallet of supplies, or pay the one paid administrator that they had on staff. So in that sense, I feel really lucky to be part of this agency. Next slide. So this is the brand new Community Wellness Center. This is insane. If you look to the bottom left, next door there's a yellow building, a little yellow house, and that's actually where my office is. Hi. But right next door we have this giant new Community Wellness Center. It's literally only been open for a couple weeks, and so this is just crazy. We have all kinds of new resources available, from a new pediatric center to labs and x-rays on site. There's going to be a real focus on like things like nutrition. There's going to be acupuncture. So really excited and have a new chapter here for Northern Nevada Hope. Next slide, please. So some of the issues we face here in Reno, I'm sure the same many of you face everywhere. Many of you may have heard that Nevada is something of a resource desert, and Reno certainly suffers from the same lack of resources as the rest of the state. But we're also a high desert, and that's the double meaning. Like, we're high desert, high in elevation, but there are a lot of people getting high in this little city. Methamphetamine is rampant, and heroin and pharmaceutical opiate use continues to skyrocket. The fact that Reno has the only SSP in the entire state is indicative of the uneven distribution of our already limited resources. We regularly get phone calls from Las Vegas from people who just Googled Nevada Syringe Exchange, and of course the fact that an area with a size and population like Las Vegas has nothing in the way of an SSP is unacceptable. But I am equally as worried about our rural communities in the light of recent events in places like Indiana. Stigma and general lack of awareness of the new HCV treatment options available keep people scared. Believing that interferon is still the only game in town creates a barrier for many who have heard the horror stories and just don't know that such effective, well-tolerated drugs exist. If people have ever heard the word Harvoni, For instance, it's usually in the same sentence as $1,000 a pill, and at that point, most people stop listening. For a brief, glorious moment, our state Medicaid was approving people with alarming regularity. Of course, that didn't last. And around the same time that Gilead announced they would be gutting my support plan, leaving it an empty shell of what was formerly a truly compassionate care plan, Medicaid started its first wave of denials. And even though these drugs work better than the healthier a person is, you all know Medicaid wants a person to be sick before they will approve payment, even though there is no data supporting that these drugs are less effective if a person is drinking or using. Medicaid is requiring clean urine from people who never had a drug problem, never injected, and in one instance I know of, they asked a gentleman who had not used drugs in 40 years to provide a urine sample. And at least in another instance, we asked for a hearing and managed to get one denial overturned, but the ridiculous time frame and bureaucratic nightmare that the average person would have to contend with in order to get a hearing, especially if they did not know about us or how to access our services, would be a significant barrier for even an extremely high-functioning and well-organized person. We had a team of 3 people working on just this one hearing request, including the person making the request, and each of us found the experience to be baffling to the point where it almost seemed punitive. But at least we were successful, so that's nice. We are finding that people in Nevada with state Medicaid seem to have better luck getting approved for Hep C treatment should they have chosen the fee-for-service option as opposed to managed care. Of course, most people had no idea at the time they were selecting their plan, and unfortunately, because of various socioeconomic factors, the bulk of our patients here at Hopes have opted for managed care. One of the primary purposes of my peer support group has become helping people to navigate this confusing, discouraging experience of dealing with public and private insurance policies before they throw up their hands in despair and give up entirely. Oftentimes it's connecting them with other people who were about to throw up their hands before they made progress and now have been cured, and that oftentimes inspires a person to keep at it. And we have seen many people come out of our group and successfully cure themselves of the disease. But housing, mental health services, and affordable health care are just a few issues that our marginalized communities must compete with one another for here in Reno. There just simply are not enough spaces available for the number of people attempting to access them. Previously mentioned, the legality of SSP was a huge barrier that took several years of orchestrated advocacy, lobbying, and perseverance to overcome. I believe that ChangePoint openly providing illegal access to sterile supplies, combined with raising awareness of the dangers of sharing and reusing anything related to preparing or injecting, will have a huge impact on Reno's transmission rates for Hep C in the years to come. But we will have to see. And next slide. Things I have learned. I have learned that that there is tremendous potential with a little bit of persistence in Reno for an individual or small group of individuals to make a difference in their community that can have profound, lasting impact. When I first got here, we had, syringes were illegal, and we had an outreach team that didn't do outreach in the winter times when people who were most in need of services, and they knew so little about safe use that they were handing out bleach kits that had empty bottles. They didn't even have bleach in them. So a lot has changed in a short amount of time. We have amazing outreach presences now, and we're able to do actual syringe exchange out of our backpack through, and Hopes has a van that we use to do testing and exchange. So much has changed in a little bit of time. And I have also learned that stigma leads directly to death. you can see the picture I put up is from Faces of the Harm Reduction Coalition conference, and this was the day that we're talking about challenging stigma, and that's my arm there and my bad handwriting, talking about how I challenge stigma just by standing up and self-identifying as a drug user and former homeless person, former a lot of things, and currently hepatitis positive for hepatitis C, getting ready to start treatment, but just self-identifying challenges stigma. Stigma leads directly to death. All it takes is one bad interaction with a provider who treats an ID or sex worker without the dignity they're entitled to, and it undermines the damaged pride of someone who's reaching out for help, and it can create a result where that person will avoid seeking help for any issue, often suffering tremendous pain rather than expose themselves to being mistreated, mocked, chided, or given substandard care. I see this every day when people come to me for advice on caring for an abscess or some other matter because they're afraid of how they would be treated if they confided in someone more qualified than me. It's quite sad because if you neglect an abscess, as you guys know, for too long, it can lead to loss of life or limb, and the same kind of neglect is happening with people out there who aren't getting tested for Hep C and aren't seeking out these amazing new treatments. So I think that's all I have for right now. And thank you very much for listening.
Excellent. Thanks so much, Joshua. First of all, your PowerPoints were great, so thank you. And this is Ryan Clary again. I just want to let folks know we'll open up for some questions that you can send through the chat feature or email to tbroder@nvhr.org. If we run past time and people have questions that they sent in that haven't been answered, we will work with the speakers to make sure those questions get answered and sent to you if we make sure we have your email address. And I just really want to thank all three presenters again for telling your stories and telling about the work you do and the thread of fighting stigma and using your personal story to fight on behalf of people living with hepatitis C. Greatly appreciated. So over to you for questions.
Great, and thank you again to all of our panelists for sharing their stories and the work they're doing. I feel really proud that you all are partners with NVHR, and I really appreciate getting to hear from each of you. So everyone, please bear with me as I'll try to triage some of the questions that came in, and for those of you who raised your hand, if you'd like to submit a question, either by emailing me or through the question function in the webinar. The first one I'll ask to all of the panelists is if you could give any advice for someone who wanted to start a program in their own community.
I don't know if I would
Joshua. Go ahead.
I was just very quickly, I don't know if I would give advice, but our experience was, and this is up to the person, obviously, was that rather than appealing to authority, we decided to just go and start doing it in the midst of trying to have it accepted by the local powers that be, if that makes sense. But I wouldn't give that as advice. I would just say that that was our experience, and that worked well.
This is Joshua, and I definitely say that when as I said, when I first came to Reno and was considering starting backpack Syringe Exchange, one of my colleagues at Harm Reduction Coalition put me in touch with some people who are already working here on a local level, a grassroots level. I had to meet with them and weigh, honestly, what I evaluated their chances of success being, and did I want to put my energy into supporting this grassroots effort which could fail, or just get out on the street and start getting syringes and naloxone into people's hands. And after meeting a few times with these people who are now my friends and colleagues and coworkers, I decided that I liked their chances, and lo and behold, we were successful. But I would definitely second that if you know, don't appeal to power if you don't have, you know, if there's no chance of success, because I mean, at least for me, I wasn't really willing to put up with you know, I had to question like how many people are going to die or contract disease or overdose while we're doing this work, and you know, those are real concerns, and that's heavy stuff to carry around. So
I think for me, the biggest thing I had to overcome is preconceived notions growing up. Obviously, I didn't contract mine through IV drug use, etc. So for me, being exposed to that side of it, I had to come to the realization of, okay, it is an epidemic. You know, they are people, and that's one thing I think as an advocate, if you come into this, you have to have an open vision of not saying, oh, well, you contracted it this way. You know, it doesn't matter how any of us contracted hepatitis C. It's the fact that we get cured, and that's what you need to focus on.
Thank you. I think we have time for just one more question. One more to ask, as we're almost at the hour, is any advice on how to better integrate Syringe Exchange with federally qualified health centers?
oh man, for me, we just really lucked out here in Reno, and the CEO of North, a woman by the name of Sharon Chamberlain, is just a tremendous ally who saw the benefit and saw, you know, who knows about, you know, evidence-based public health practice and common sense drug policy, and saw a perfect fit for Syringe Exchange within the framework of what was to become the FQHC. The FQHC was a recent development, and I think she stuck her head out and took a risk, and you know, so it was just really, really lucky. And I believe that as we were lobbying for syringe access in Nevada, having a legitimate agency like Hope step forward and say, you know, should this legislation pass, we would be willing to house the actual exchange, actually helped out tremendously. But in terms of how to make that happen in your neighborhood, I wish I could give better advice on that. And I'm going to think about that question after. If I come up with anything, I'll let you know, and hopefully that information can get along with you. But I really feel like the honest answer for me is just luck. We just had a really good ally in a really high place at this FQHC.
Definitely got several more good questions asked. So what I'll do is try to circulate them to the panelists, and then when we send out an email with the recording and the we'll try to include more answers, and we'll also include that information when we post it on our website. So thank you, everyone, to the panelists and the attendees for participating in the webinar today.
Thank you.
Thank you. Bye-bye.